So we have to move on. The next speaker is Professor Angelica Tiotiu from Brussels now. Nowadays from Brussels. Yes, and she is deeply involved in the activities of INTERASMA because she is managing INTERASMA scientific network, and she provides some issue about this activity because she will speak about the INTERASMA survey on the house dust mite, allergy and biologics. Thank you, Angelica.
Thank you very much for the invitation to give this talk today. As a background, I'm a pulmonologist and allergologist, and I'm now in Belgium after 16 years passed in France, and at origin I'm Romanian. So I will present, here you can see my disclosures, and I will talk about our two surveys realized into the Global Asthma Association during the last 2 years. The first one is the questionnaire for the house dust mites induced allergy. You know all that HDM is a major source of indoor allergen and the most commonly associated with asthma, with a prevalence of allergy to HDM found in near half of asthma patients. We know also that asthma patients with HDM sensitization have recurrent exacerbation, impaired lung function, and increased asthma severity. And as you know also, HDM allergy is a potential target for allergen immunotherapy and recommended by EACI and GINA as add-on therapy in patients with well-controlled and partially controlled allergic asthma. Our aim was to concept a questionnaire to use in clinical practice for the screening of patients with suspected HDM-induced allergy, because currently we have now such a tool for our practice. And we applied the Delphi method. I was the facilitator. I identified several experts across the world. We defined the problem, and during 4 rounds, we arrived to have a final questionnaire. So we included 90 members in the panel, in the expert panel of experts very recognized in asthma and allergology, selected based on their clinical experience, prior published research and membership in Global Asthma Association, 10 pulmonologists, 5 pulmonologists and allergologists, and 4 allergologists. Here the method. Firstly, the first step was the conceptualization of the questionnaire. During the round 1 and 2, the questionnaire was validated by the expert panel. During the round 3, we realized a survey in mass across via the INES platform. And during the 4th round, we analyzed the results and we validated the final questionnaire by the expert panel with suggestion for questionnaire scoring to use in clinical practice. Initially, the questionnaire involved 15 questions with 5 possible answers, scoring between 2 points for A, no importance, B, 4 points for low importance, C, 6 points for moderate importance, D, 8 points for high importance, and 10 points E for very high importance. And as you can see, the more of questions were based on the interrogatory on the variation of the symptoms, with worsening indoors during the night or upon awakening, with an improvement during the day and outdoors, with a worsening in the bedroom or dusty place during the cleaning up of the house, in the hotel rooms, when exposure to carpet, stuffed animals, or curtain, and also based on the variation of the symptoms with an aggravation in the spring and autumn during holidays, and also improvement by antihistamine, nasal corticosteroids, and variable across the humidity in the domestic environment. During the first round, we validated the questionnaire according to the predefined rules. To keep an item in the questionnaire, we choose a median value superior or equal to 7, and at least half of responses scored with high importance and very high importance. And you can see here in the table, in red, the questions, who had a median value superior or equal to 7, and more than half of the responses with high importance and very high importance. And all 8 questions selected after the first round were validated in unanimity during the second round by the expert panel. The third round was the electronic survey realized via INTERASMA scientific network by using also a mass email to Global Asthma Association members, contact list of the co-authors, National Association for Specialists, and social media between the 1st April and 31 May 2024. The analysis was done for each item of questionnaire. We realized a descriptive analysis according to the repartition of the answers and a median score for the answers, and the predefined condition was the same as the first 2 rounds. We had 347 questionnaires completed by specialists in allergology across the world from 27 countries. And you can see here the distribution of the participation by each country. Thank you, Italy, for the higher prior rate of responses, followed by Belgium, Poland, Mexico, and Brazil. And we can see here also the equal repartition by the gender of participants. For the first question, do you have more symptoms indoors than outdoors? You can see here that the median was 8, and 72% of responders agree with the high importance and very high importance of this question. For the second one, are your symptoms predominant in the night or upon awakening? A similar median, and also a predominance of responses, high importance and very high importance. The third question was, do you have more symptoms in the bedroom than in other places of your home? Similarly, a median 8, and 68 of responses, high importance, very high importance. And for the fourth question, do you have symptoms when you are entering in a dusty place? 3/4 of responses were high importance, very high importance, and a median of 8. For the fifth question, are your symptoms more important in a place with carpets, curtains, or stuffed animals? And the 16th one, do you remark a worsening of your symptoms when you are cleaning up your home? 3/4 of responses were in favor of high importance and very high importance, and both median were of 8. For the question, do you have symptoms that persist all year round? We have also 2/3 of responses with high importance and very high importance. And for the last one, did you remark an aggravation of your symptoms in spring and autumn or during Christmas or New Year holidays? We have also more than half our answers with high and very high importance, and both median was of 8. Here you can see the ranking of the answers, high importance and very high importance, and the question following this ranking. Finally, we validated the questionnaire. All the questions were validated by the expert panel, by fulfilling the predefined conditions. And we suggested binomial answers for each question, with score yes 1 point, no 0 points, and a score superior or equal to 5 is suggested as compatible with high probability of HDM-induced allergy. In conclusion, our questionnaire could represent a simple and useful tool to apply in clinical practice for the screening of patients with suspicion of HDM-induced allergy. And these results are now, I'm working now on a paper with these results. Of course, this questionnaire should be validated in the future. The second survey is realized to find criteria to evaluate the efficacy of biologics in asthma. As you know, you have increased number of biologics to treat more the T2 inflammation in asthma, from anti-IgE, the first one, omalizumab, followed by mepolizumab, reslizumab as anti-EL5 antibodies, and benralizumab, the anti-EL5 receptor antagonist, and more recently with the tezepelumab, the anti-SCP antibody, with other antibodies currently in study targeting anti-EL23, the other alarmin who are involved in pathophysiology of asthma. And you know very well what are the criteria of eligibility for these biologics before starting them, well defined by GINA guidelines, and GINA guidelines recommend to assess the response to biologics after at least 4 months of treatment. However, we don't have currently well-defined criteria for a good response. So GINA guidelines recommend to consider exacerbation rate, symptom control, lung function, side effects, treatment intensity, including oral corticosteroid dose, and patient satisfaction. And when we are looking at the literature, we can see different criteria used for the clinical studies and also in clinical practice by several practitioners. The most recognized is the minimal clinically important difference, and you can see here the criteria. And we can see also more complex criteria, like a standardized measure to assess response to therapy, but this kind of criteria, it is very difficult to apply in clinical practice. So our objective was to establish a consensus criteria to use in practice for the initial evaluation of response to biologics after 4 months of treatment. And we was focused on the symptoms improvement, exacerbations improvement, side effects, and lung function. It was the same method, the Delphi method, applied for the second survey. I was the facilitator, and the 13-member panel was included 7 pulmonologists, 4 allergologists, 1 internal medicine specialist, and 1 pediatrician, selected on their clinical expertise, prior published research, and membership in Global Asthma Association. And you can see here that this design was the same as for the previous survey. The first step was the conceptualization of the questionnaire, and 10 items were proposed to improve the ACQ score by 0.5 or the ICT score by 3 points, to obtain an ACQ score inferior to 1.5 or an ACT score superior or equal to 20 points, to decrease the number of asthma exacerbation requiring systemic corticosteroids by at least half, to have no asthma exacerbation requiring systemic corticosteroids, to improve the FEV1 by 10%, or to improve the FEV1 by 12% and 200 milliliters, to reduce daily oral corticosteroids dose by at least half, to achieve complete withdrawal of daily oral corticosteroids, to have no side effects, and to have minimal side effects. The questionnaire was validated during the first two Delphi rounds by the expert panel. Panel members rate each item as a level of agreement on a scale from 0, total disagreement, to 9, total agreement. And the predefined rule was a median value superior or equal to 7 and considered as appropriate to keep the item in the questionnaire. And you can see in the table the results of the first and second round, and all the median score were superior to 7, and you have also the proportion of responses with score reaching 7, the median of 7. During the round 3, we done the electronic survey across via the INESnet platform, and also the mass email to Global Asthma Association members, contact list of the co-authors, National Association for Specialists, between the 4th July and 31 August 2022. For each item, we realized descriptive analysis according to the answers and the scoring of the answers, with the aim A 2 points, B 4 points, C 6 points, D 8 points, A 10 points to compare the items, and the predefined condition necessary for the selection of criteria were a median score superior or equal to 7 and more than 60% of responses high importance and very high importance, and all selected criteria were validated by the expert panel. We had 132 questionnaires completed by specialists in asthma across the world from 31 countries. And you can see that more than half of participants were pulmonologists and 1/3 of them allergologists, that specialists were less involved. There is a predominance of males. And when we are looking to the age of the participant, most of them are clinicians with experience, because more than 1/3 of them have between 50 and 60 years old, and 28% of them between 40 and 60 years old. Here you can see the distribution of the responses across the world, and the most important proportion was in France, followed by Greece, by Argentina, Italy, and Mexico. For the first two questions, focused on the control of asthma, we can see that the median of answer was 8, but the mean value significantly different, with a preference for the participant to obtain an ACQ score inferior to 1.5 or an ACT score superior or equal to 20 points, and a greater repartition of the answers high importance and very high importance for this item. For the question 3 and 4, focused on the asthma exacerbations requiring systemic corticosteroids reduction, we can see here that the median for the second one, to have no asthma exacerbation requiring systemic corticosteroids, was higher of 10 compared to the first one, to decrease by half the number of exacerbations. For the question concerning the improvement of the lung function, we can see that the most of participants found this question as moderately important in their practice, and the median for both items were 6. For the concerning the oral corticosteroids dose to reduce the daily dose, We can see here a preference also of the participant for the second item to achieve a complete withdrawal of daily oral corticosteroids, because the median was 10 compared to the other one, to reduce by half the daily dose after 4 months of treatment. And concerning the tolerability, we can see that most of participants consider that the good tolerability is very important for the clinical practice. And the median for both items were 8. Here you can see the top 10 ranking for answers very high importance and high importance. And the first 5 items ranking very high importance and high importance are enumerated here. To achieve complete withdrawal of daily oral corticosteroids with 91% of responses, to have no asthma exacerbation requiring systemic corticosteroids, and to reduce daily oral corticosteroids dose by at least half with an equal participation, 88%. To decrease the number of asthma exacerbation requiring systemic corticosteroids by at least half with 86% of answers. To have no or minimal side effects with 77%, and to obtain an ACQ score inferior to 1.5 or an ACT score superior or equal to 20 points with 71%. So we validated the 4 criteria for evaluation of biologics efficacy in asthma after 4 months of treatment: to reduce daily oral corticosteroids dose by at least 50%, ideally to achieve complete withdrawal; to decrease the number of asthma exacerbation requiring systemic corticosteroids by at least half, ideally no asthma exacerbation after starting of biologics; to have no or minimal side effects; and to have asthma control, an ACQ score inferior to 1.5 or an ACT score superior or equal to 20 points. And we propose that the achievement of at least 3 criteria is necessary to conclude a good response to a biologic after 4 months of treatment. Of course, several of these responses is in line of our acknowledges, and we know that the specialists accorded high importance to the reduction withdrawal of daily oral corticosteroids use, viewing their side effects. And the second objective for the participant when they prescribe biologic was to reduce the number of exacerbation requiring systemic corticosteroids. And you know that even the intermittent administration more than 4 times per year is associated with an increased risk for experiencing new adverse events. And there is a positive dose-response relationship with increasing risk of most adverse outcomes when progressing from a cumulative systemic corticosteroids exposure of more than 0.5 gram compared with less than 0.5 gram. The specialist prescribing biologics accorded a high importance to the good tolerability of these treatments, and the achievement of symptom control evaluated by the validated questionnaire ACQ or ACT was considered more important than the significant improvement of the score after 4 months of treatment compared to baseline. In conclusion, our survey identified 4 criteria considered as important by specialists for the assessment of the efficacy of biologics after 4 months of treatment in severe asthma patients, and these criteria could be used in clinical practice and research works. Thank you very much for your attention.